I'm Dr. Balaji Jaganmohan. I'm a practicing diabetologist at the Apollo Sugar Clinics at Padmanabha Nagar and JP Nagar in Bangalore. Today I want to talk about the use of insulin in the management of type 2 diabetes. Now, there is a myth that if you start insulin in a patient, then that might indicate that it is the last stage of diabetes and taking insulin can lead to early death in that individual. So, these are myths that need to be abolished. In fact, insulin is one of the best drugs that can be given to a diabetic individual. If it is started early, the patient can get the early benefits and they can prevent the complications that are associated with diabetes like microvascular and macrovascular complications. Now, when we start insulin, generally there is something called a long-acting insulin that is first started, because what happens, the fasting blood sugars tend to be on the higher side, especially if the patient has a longer duration of diabetes. So this long-acting insulin, we call it a basal insulin, and it can be either a human insulin or the more advanced ones called the analogs. Now, suppose the patient has already put on these long-acting or basal insulins and the fasting has come under good control, but still the HbA1c is not under control, then that is an indication that we need to intensify insulin therapy. And how do we intensify? We can intensify by starting either something called a pre-mix insulin, which is a combination of a short-acting and a long-acting together, which is generally given twice. And here also you have the human and the analog insulins. Or in some instances, you might have to continue the basal or the long-acting insulin and start short-acting insulins, which are given individually or separately. But remember that insulin will give you the best blood sugar control and you can have maximum HbA1c reduction. In fact, there are certain conditions like chronic kidney disease, heart failure, and even chronic liver disease where you might only have to keep the patient on insulin. So do not be afraid of taking insulin. If your physician feels that insulin is the best at that point of time, accept it, give it a trial. In fact, in the future, there will be different formulations of non-injectable insulin like oral formulations or insulin patches that are applied to the skin that will also be available. But currently we only have insulin which has to be taken as an injectable. Be watchful of hypoglycemia, which is the most common complication when we start insulin, and always have a glucometer at home once insulin has been started, so that we can monitor the blood sugars. If there is any hypo or hyperglycemia, then that can be picked up and corrective measures can be taken appropriately. So it's a myth that if you start insulin, it's the last stage of getting treated for diabetes. Insulin is in fact one of the best drugs that a diabetic can receive, depending on the type of insulin that is given. Do not delay your initiation of insulin if the blood sugars are on the higher side. It will only increase the risk of you developing complications. Thank you.